Okay. Hi, everyone. Thanks for joining. I'm very excited to finally be able to do some education during this COVID time that we're in right now. So this is a very important topic for us to address, high blood pressure. It is also known as our silent disease. So I'm going to start off our first slide with the prevalence of high blood pressure with adults over the age of 20 years. So as you can see, we have males and females in different age categories, and blood pressure, surprisingly, is more prevalent in men over the age of, starting at the age of 40, and rapidly starts to increase. And then unfortunately, women also start to have an increase starting as late as their 30s, but we see a significant increase in the mid-60s region where there's a more of a percentage of females experiencing high blood pressure. It's possible that women have a harder time acknowledging that they have high blood pressure because they're unaware. It's also unexplained whether or not they are checking up and following up with their primary care physicians. This goes for both genders. So now going on to the next slide, our agenda that Jason and I will be going over today are definitions, causes, risk factors for high blood pressure, going over the prevention and treatment, significantly going over the reasons why diet and activity are important for us to incorporate for lifestyle changes, stress reduction, and I'm going to just touch on a few medications that contribute to high blood pressure, but will not be going over specific blood pressure medications. I also want everyone to hold their questions if they have them, and we'll be managing these questions towards the very end.
Sorry about that. Okay, so my real focus as a dietitian is around lifestyle change, and I really like this quote, so I'm just going to read it to you. What if I could prescribe a pill that could prevent or treat high blood pressure, diabetes, high cholesterol, heart disease, even depression and dementia? And what if researchers had extensively researched this pill, and the result was ample proof that it's effective? On top of that, it's practically free and has no bad side effects. As a matter of fact, its only side effects are improved sleep, increased energy, and weight loss. And this is from a doctor and researcher out of Harvard. And of course, this powerful lifestyle pill doesn't exist as a pill, but it does exist. And this medicine is real, right? This is exercise, this is nutrition. So we're going to look into today what those specifics are, in particular for high blood pressure. And I'm going to use something called the DASH diet to help us understand the importance of and the impact that nutrition can have on blood pressure. And the reason I'm using this diet is because it is one of the most researched diets that we have. It's got the most evidence that it is effective. It's been used for over decades. In fact, last year was the 20th anniversary of the diet, and we're still celebrating because it's just that good. So, but there's an issue with this diet in that it's been around for a long time. You may or may not have heard of it. Most people don't follow it. And why is that? It's not as sexy as things like the Atkins diet or the keto diet or the paleo diet. We don't hear about it in those similar ways. And as the Journal of the American Medical Association pointed out in an editorial marking the anniversary of the DASH diet, that it really could use a PR person, a new marketing campaign perhaps. And I've stolen these phrases from them. And I really like the last one, of course, very relevant to today. Eat like this to dash your, sorry for the typo there, to dash your high blood pressure. So the name itself, I haven't really explained that. Dietary approaches to stop hypertension. Again, kind of tells you what it is, but not super exciting. So really what it's about is, eat like a sensible person who cares about their health. And that doesn't always hook people, unfortunately. So while the focus of the DASH diet initially was about blood pressure, as the name describes, and when that is conveyed, most people think, oh, it means eat less salt. And it does do that, but that's only one piece of the whole thing, of the whole pie, as it were. So you can see that this is really a complete dietary approach that provides the health benefits of the symphony of nutrients that we talk about in terms of why whole foods are healthy and why research around people who eat lots of whole foods have lower instances of disease, better blood pressure, for example. And you can see the bounty here on this slide. It's very colorful. It's not very restrictive. There's a wide variety of foods available to you, but it does focus on eating a lot of vegetables, a lot of fruit, lean meats, beans and legumes, whole grains, and reducing processed foods, along with high-fat animal foods. So I'm going to talk about those details in a little bit. And as you look at this, you might recognize some things. It might look rather familiar to you. This is also a lot like the Mediterranean diet, which has gotten a lot more press over time. Okay, so let's look at some of the health benefits of this diet. It has been shown to lower blood pressure from around 8 to 14, 15 points, something like that. And Michelle will show some information about how all the different lifestyle components, from exercise to diet and more, can help you reduce blood pressure, and specifically looking at those numbers. And this also, the body is a system, right? It's not like we isolate one thing and say, oh, this is going to improve your blood pressure. It will. It also is going to improve everything else, all the other organ systems in your body. So you can see that. I've bolded a couple of words over here on this slide that are connected to heart health in particular that we're going to be talking about today. So studies around the benefits of eating this way help to reinforce our understanding and the power of whole foods to help protect our health. Another key point here is that you don't have to follow this diet to 100%. It doesn't have to be perfect to get health improvements. You can gain benefits from changing your diet in increments. You'll get incremental benefits. So let's look at how you can follow this diet. The author and food system advocate and Bay Area resident, Michael Pollan, has a very simple lifestyle prescription for us all. You may have heard this before. His one phrase sums it all up: eat food, mostly plants, not too much. So what is this about? Eating whole foods, not processed foods, especially grains. Mostly plants, making half your plate vegetables. This is limiting the animal products we were talking about. And not too much. Portion size is important. So I'm going to go through those three components of his prescription and how that relates to the DASH diet in turn. And I'm going to start in the middle, the mostly plants part, because that's really the powerhouse of the nutritional medicine cabinet that you have at your disposal. These are the foods that supply nutrients that actually can help balance out our sodium intake and help create a healthy system for our blood pressure to work better. And I'll talk a little bit more about how this impacts your arteries as well. And these health benefits of plants come from things that you have probably heard of: antioxidants, vitamins and minerals, anti-inflammatory compounds, fiber, and then essential nutrients that we need for health. These compounds are chemicals that our body is using. They're building blocks for health. They're feeding our cells the nutrients that the cells need to work at their optimal level. Let's see. Oh, sorry, I meant to have, okay, let's show you, I want to show you a couple of keys to increasing your vegetable intake. So as we go through, I'm going to talk about some concepts here, but try to make things as practical as possible for you. So they're going to be, take home things you can do to improve your health. When I talk about increasing fruits and vegetables, most people know that, right? That's not news to anyone. But how you do it, that is often a challenge. So most of the patients I see understand this concept and yet struggle to do it in their own lives. And of course, this all starts at the grocery store. If you don't have it in the house, you're not going to be able to eat it. So when you're at the store, look at your cart. Is most of the food in there fruits and vegetables? Then you're doing it right. If not, add some more. Take out some of the processed foods. It starts there. You can look at the colors in the cart as well. And planning is always important. If you want to make a change in your life, whether it's exercise or nutrition, you need to plan it. Doing some meal prep, making sure you use what you buy from the grocery store, batch cooking. All of these ensure that you don't have to scramble to make a meal at the last minute when you're likely hungry and gonna then lean towards convenience foods or foods that are easy to make and likely less healthy for you. Making sure that every meal has some vegetable in it. That's another way to do this. There's different ways to think about how much vegetables you need. There are serving sizes, how much fruit you should get, how many cups per day, those kinds of things. But really, if you're eating fruits and vegetables at every meal and it's half your plate or more, then you're getting enough. You can also try sneaking these into meals that you already eat. So I'm going to talk a little bit more about that in terms of a pasta dish in a minute. Oh, and here we have our last line, which does include that, things like casseroles and one pot meals, that kind of thing. Okay, so back to the beginning of Michael Pollan's prescription: eat food. Very simple, right? That's what we eat. But ask yourself, what is food? Now here we're talking about reducing the type of food that makes up 60% or more of most average Americans' diet. This is highly processed foods like donuts, French fries, pizza, deli sandwiches, chips. So a good guide here is, can you see the food in your food? For example, if you're looking at a French fry and you didn't know what a French fry was, could you tell that it was a potato? How about a potato chip? So it's not that potatoes are unhealthy for us. It's when they're processed, it's when they're refined, it's when they're concentrated, and it's when things are added to them that it becomes an issue. So eating this way will automatically decrease your intake of things like saturated fat, sodium as well, while increasing your intake of all those nutrients I talked about before, along with things like fiber. Okay, so let's talk about salt a little bit. And here you can see some of the numbers. And just like with fruits and vegetables, you can use numbers to help guide you in how you eat. And it's a good idea to have a general understanding of these. But for most of my patients, they're not taking a calculator and adding up all the milligrams of sodium they're taking in. So I'll talk a little bit more about some tips on reducing sodium without relying just on numbers in a bit. But a little bit of background here too. 90% of Americans eat too much salt in their diet. You can see that here. In fact, more than twice the recommended amounts in general. And just for a frame of reference, 2 grams of sodium or 2,000 milligrams is the amount of sodium that's in a teaspoon of salt. So you can understand how quickly we can get to these high numbers of 4,000 to 6,000 milligrams per day. So these low sodium, decreasing your sodium and following these recommended intakes will help to keep blood pressure from rising, and helps, if you're on medication, helps the medication to work better. For people with high blood pressure, sometimes the doctors will recommend lower amounts. So that's why you see a range here between the 1,500 and the 2,300. One estimate about reducing sodium intake states that if the average American were to cut back to 1,500 milligrams per day, it could result in over a quarter, 25%, of cases of high blood pressure disappearing. So healing that issue for a quarter of the people who have it. As we're going through, I would like to share a poll with you if I can get it to work. All right, here we go. So this is going to pop up on your screen, and it's a simple yes/no question. All right, let's see. There we go. All right, so this should pop up on your screen. Go ahead and just type this in. This will be anonymous, so we won't be able to see who answered in what way. And once you've completed this, I'll share the results with you all. Okay, so as we're talking about salt, let's look at where it comes from in the diet and see the impact of eating whole foods. So you can see here that the vast majority of the salt that Americans are eating really comes from not what we put in our food when we're cooking or what we put on our food at the dinner table. Those are relatively small amounts. The biggest part comes, again, from those processed foods that Michael Pollan is advising us to not eat very much of when he says eat food. Okay, so the results are in, and you guys get an A+. I'm happy to see that you are all aware and using those nutrition labels to help you manage your salt intake. Okay, great. And that helps me too, so I won't spend too much time talking about that. So nearly 40% of the sodium we eat, we being the average American, comes from 6 foods. So let's look at that. And this information is from the American Heart Association, which at the end, Michelle and I have some resources that we'll share with you guys, and you can get the slides as well from emailing us or entering information into the feedback form. So if you want that, you can get that. So looking at this, the salty 6, as they're called, you might be surprised by some of these foods because they don't necessarily taste salty. And the one that I think stands out really clearly in that is bread. 1, 2, and 3 all have some form of bread. Pizza, the sandwich, obviously bread and rolls. And while these foods are not considered high sodium foods by themselves, because we eat so much of them over the course of a day, it adds up. So this is a key concept here, and this is the one, not too much part of Michael Pollan's prescription, which is if you eat a large quantity of something, then you're going to get too much of something, right? So pizza is a good example of that. If you have a slice of pizza, you're likely to be fine with your sodium intake. If you have 3 slices of pizza, that's going to shoot you way over the daily recommendation. So by looking at this, you can start to see that you need to be an informed consumer. Do a little research, just pay attention, and the food labels are one good way to do that. Okay, so a couple of quick tips here. And as we just saw, keeping the focus on eating food that is less processed foods will have the biggest impact on reducing your salt intake. Now, one advantage to our difficult quarantine situation right now is that many people are eating out less, cooking more. So that's automatically reducing prepared food in the diet, which is going to result in a lower sodium intake. On food labels, you can count milligrams, as you guys may be doing. You can also look at, just want to point one thing out, which is the percent daily value can be really useful. And you can look for things that are 15% or lower as a meal to help you, to guide you through that. Making sure that you're checking things like canned soups, sauces, dressings, condiments, those kinds of foods. Okay, So the last component of our lifestyle prescription is about size. Size of your meals, which can influence blood pressure in one sitting, but also over time. And this is the connection between what you eat and body weight and blood pressure. And Michelle's going to talk a little bit more about the impact of body weight and weight loss on blood pressure. So while excess food can lead to excess weight, you want to watch that to make sure that you're not getting too much in total. Also at one meal though, overwhelming the body's metabolism, overwhelming the body's digestive system can increase blood pressure in the short term. And you do this over time. The more often you do that, the system starts to wear down. And you're basically putting stressors on the system, and then it's going to become less resilient to aging, less resilient to eating excess foods, those kinds of things. The last piece of this is stress, and we'll talk about stress management a little bit today too. Michelle will mention the impact that stress can have on blood pressure, and I'm going to discuss how you can right size your stress. Okay, so a key concept with the too much in terms of food is that eating too much in general, or too much processed food specifically, will exceed your body's ability to handle that food, to digest the food and to distribute it throughout the system. So this is what I was just talking about in terms of overwhelming your metabolism, overwhelming your digestion. So foods are broken down into macronutrients, right? We have our proteins, our fats, and our carbohydrates. When we have too much food, blood sugar and cholesterol levels can rise too high too quickly, which creates a whole cascade of issues in the body. The liver has to respond to, and things get stored in ways, fats get stored in ways that are less healthy. This creates, again, kind of a taxing of the system. So decreasing the functioning of the liver and even the heart, and creating unhealthy patterns in the body. So Michelle's going to show you how weight loss is related to blood pressure, but I just wanted to mention a few things with it because this eat less component can have something to do with that. But not just the eat less, the eat food part can too. So here's a good example of how that can work. On the left-hand side, you can see this is like macaroni and cheese, basically. And on the right-hand side, it's a little hard to tell from this picture, but there's added vegetables into it. And some of the macaroni has been removed. So basically, you've got the same general meal, macaroni and cheese, but you've added vegetables and you've reduced pasta. And you can see the calorie difference here, right? And of course, calories are only one part of the impact of a meal. As we've been talking about, nutrient composition has a big impact as well. So on the right-hand side with the vegetables, you're getting fiber, you're getting the antioxidants and the micronutrients that are feeding the cells and helping the blood pressure to function better, helping the heart to function better. On the left-hand side, you're not getting that, in addition to getting excess calories. So to control body weight, either to lose weight or to maintain a healthy weight, you can go back to this DASH concept of aiming for half your plate vegetables. So the simple truth is that the average person in the US eats too much food, too many calories, and of course, not enough fruits and vegetables. So with this kind of plan, you can change the nutritional impact of how you eat without changing the kinds of foods that you're eating. So I like the DASH diet in that regard because it's really accessible to anyone, any culture, any tradition, any taste buds, maybe with a few exceptions. Sometimes I'll have patients who are just like, I don't like vegetables, I can't eat them. And that can be a place to work though, right? So something to know is that taste buds are trainable. You've probably experienced this in your life. Think about, what you like to eat when you were a kid and what you like to eat as an adult. Tastes do change. So to further understand this concept of what the composition of your plate, we have this slide here, which shows foods on the left that are nutrient dense and high volume. This is going to help fill you up without causing that overwhelming of your metabolism or your digestion, while the foods on the right are doing the opposite. Again, getting back to our lifestyle prescription, eating food listed on the left, not too much. Don't eat the foods on the right too often or in too large of quantities, and mostly plants. As you can see on the left, we've got fruits, vegetables, grains, and beans. Okay, so the last piece of the not too much idea is about stress. Poorly managed stress can impact blood pressure. And of course, we're all feeling increased anxiety while we're coping with the pandemic and the dramatically changing economic situation and social world. So, as is clear right now, we can't always control the amount of stress that's in our lives. And I'm going to try another poll with you. So bear with me for 1 second. All right, it's coming your way. So this one is really just about if you are doing something daily to help manage your stress. So I've got some, while you can't necessarily control how much stress is coming into your life, you can consider how you react to it and whether you have some kind of daily relaxation process or activity to help you manage and become more resilient to the stressors that are, frankly, just an obvious part of our modern world. So on this slide, there are 4 different boxes. You can see each one taking a slightly different understanding of how to manage stress. One is about training your brain, and this is to help you create less reactivity patterns of thinking in the brain that can increase anxiety around stress. One box, this is about the relaxation response, and this is the one I'm going to give you an example of, and we're going to have a little exercise together. And this is really about triggering this release of tension that is a natural part of the response to stress for most of us. We really carry it physically in the body, and this can be done through breathing exercises or things like taking a warm bath, drinking a nice cup of tea, something like that. And of course, a healthy mind is one that is well rested, well fed, well exercised, and well socialized. So there's 4 components to having a healthy brain, and you can work on any 4 of those things to try and increase your resilience to stress. And the last piece of the methods I'm talking about for stress management is awareness. And awareness is just about really being aware, understanding what's going on for you, what's causing you stress in your life, and are you doing something to help manage it? So you can see here we have a split score on the stress management. So hopefully you'll take some information home from this presentation, and maybe those of you who don't can try some of these things out. So we're going to have an opportunity to do that here. Okay, sorry. And this slide, what I'm getting to here is that you have the power to instantly create a state of calmness, both mentally and physically. This is something that's innate in all of us. And we can start to learn to use this in times of stress and when we're feeling overwhelmed. But engaging in that in those times when we're highly anxious is sort of like going to the gym the first time and lifting the 100-pound weight. You're unlikely to be able to do that. You got to start smaller. So this is why we talk about it in terms of being a practice, starting at a time when things are calm for you, when you're not stressed, and then you can start engaging in the activity, the exercise in moments when you really need it. This quote that I have up here from Dr. Benson, he is the physician who coined the term relaxation response back in the 70s. He was a professor, author, cardiologist, and he was the founder of Harvard's Mind-Body Medical Institute. So this is his quote describes what the relaxation response is, and while you're reading that, I'm going to just pull up something for you guys to try. Get this out of the way. Okay, so what I'd like to do is to have you try out this box breathing technique. So this is often used by first responders, police and soldiers, people who really have very stressful situations that they find themselves in, and they use it to help calm and balance their nervous system in those times. But again, they don't just learn this and then go off and do it, right? They practice it. So it's got three steps basically, and I'm going to walk you through how it works, and then we're going to try it. So basically, it's done on counts of 4. So you inhale for 4, you hold your breath for 4, then you exhale for a count of 4. Okay. So go ahead and, if you're comfortable, close your eyes and begin breathing in and out through your nose in a relaxed manner. Don't start the counting quite yet. Just notice what that feels like. Bring your attention to your breathing. And when you're ready, breathe in for a count of 4. And hold for a count of 4. And exhale for a count of 4. Go ahead and repeat that on your own a few more times, counting to yourself. And when you're ready, go ahead and open your eyes, coming back to the room. So as you went through that process, I'd like you just to kind of reflect on, did you notice any difference? Did you notice any changes in how your body feels, in what's happening in your mind? And there's no right answer here. These practices are not intended to add more stress on top of things like, oh, I did it wrong, or I didn't have the right experience. There's no right or wrong experience. It's a little bit like lifting weights, like I was talking about. It's a training of the physiology. So the more you do it, the more you'll start feeling relaxation. Generally, what you want is a sense of releasing tension from the body. Okay, thank you for indulging me with that simple exercise. All right, so bringing all of this back together, you can understand the direct impact of diet on blood pressure as increasing, I'm just talking about the pliability of your arteries. And, before Michelle got cut off, she was talking about how blood pressure and the arteries are working. So you'll get back into that in a little bit. This is sort of, understanding health from the inside out. We're understanding nutrition here from the inside out. So these nutrients and compounds and whole foods that I've been talking about, all of these have a direct effect on blood pressure in the time, right after you eat the meal, because they're helping the vessels and the arteries be less stiff, more pliable. Eating lots of processed foods, too much foods, lots of high-fat animal products, lots of salt, this has the opposite reaction. So the way that you eat will impact your body and your health from your physiology, metabolism, digestion, your arteries, flexibility, and your mood and your stress, which all also relate to controlling blood pressure. So thank you for your attention for nutrition component. And I see I've had a couple of questions, so I am going to hold those to the end, but I do see those. Thank you for that. And if you have more, continue typing them in. We will allow time for that towards the end. Okay, so I'm going to go ahead and stop my share, and then I'll pass it over to Michelle.
I believe we left off on we went into what the coronary arteries are, what healthy arteries look like. And we have a constricted artery, and I was just about to go into what are risk factors that are some of the effects of having high blood pressure. So let's go on to this next slide. So some of the increased risks related to high blood pressure include stroke. And I have a pretty unique story to share with you, which is one of my reasons why I'm doing a presentation today on blood pressure. One of my best friends' moms passed away from having a stroke because she had what you called silent hypertension. She wasn't taking any medications, and she was not going to the doctor, and that caused her to be kind of unaware of how high her blood pressure went up to be. And unfortunately, she passed, and my best friend and I are still missing her. So stroke is one of the main causes for one of the deaths for untreated hypertension. As many as 6 million people worldwide die to having a stroke. My second, I have here vision loss, and I wanted to clarify why. So sometimes you can have increased retinopathy, which is also tied with diabetes. And you can also have fluid buildup under the retina, and nerve damage, which is optic neuropathy due to increased blood pressure. So you could have some vision loss. Heart failure and heart attack. So they're tied, maybe the same. Well, okay. So blood pressure, increased blood pressure can cause atherosclerosis, which is the hardening of your arteries. And when you have the narrowing of the arteries, as we saw on that previous slide, then you have reduced blood flow. So we have these vessels in our bodies, veins, arteries, capillaries, all carrying blood, carrying oxygen to all parts of our body, and removing oxygen and getting it oxygenated. So when you can have a heart attack when a clot is formed, or when the coronary arteries are reduced in their ability to flow blood to the muscle of the heart. So on the other side of that slide, I have here heart failure. So heart failure is a little bit on the different spectrum. You have the heart muscle itself working extremely hard to pump all the blood in the ventricles back to the lungs for everything to get oxygenated. And there's either a backup that happens. The muscle itself gets very thick, and the chambers of the heart are reduced in terms of size. So there's not enough blood that is in those chambers. So there's a reduced capacity. And so your heart is losing its ability to pump blood effectively to the rest of its entire body, and even to have it being pumped to the lungs. So very serious. There are a lot of patients that end up in our program having a heart failure, and we are managing them with a lot of medications, diet, lifestyle changes. We have them also making sure to not have increased amount of salt. Jason pointed out a lot of great examples as to why salt needs to be regulated. This is one of the main reasons, especially for those who have heart failure. Now going on to the next two risk factors, we have kidney disease and kidney failure. So there are vessels in the kidney that become narrowed, and when you have reduced flow to the kidneys, then you are now injuring the kidney itself. And so you're developing kind of a failure in a sense. And I put down over here sexual dysfunction because in today's world, we have men who have ED, and still unknown whether or not it's a contributing cause to women. There are not enough studies that say that women have sexual dysfunction for high blood pressure. But men that do would need to contact their cardiologist, primary care doctor before starting any ED medications if they have high blood pressure. Partly because most of the medications that are prescribed for this are increasing the amount of blood flow, increasing the amount of blood flow to all areas of your body, including the penis. So, and that could be detrimental in case you end up having a heart attack, because one of the medications that you take for a heart attack would be nitroglycerin, which is also a medication that increases blood flow. So I would highly advise to check in with your physician. Okay, so let's move on to our next slide. What do the blood pressure numbers mean? So we have the top number, which is the systolic number, and a diastolic number, which is the bottom number. And basically, it's when the heart pumps blood, it's working. So there's a lot of pressure buildup, and that is that systolic number. And then the diastolic number is when the heart is relaxing. So that's when the blood vessel itself is relaxed. The pressure inside is in a relaxed state. You could have high blood pressure with a high diastolic. And again, we'll go over the regular ranges for those in a couple slides. So I have a poll that I would like to send out for all of you. So let's take a look. 1 second. 1 sec. Actually, I may have my co-host launch this poll, since I am not seeing the screen that allows me to do that. So just 1 second. Here we go, polling. So my question, I'd like to see if everyone can see. How often are you checking your blood pressure? Are you checking it daily? And it's okay if you're not checking it daily. Okay. So let's just share with everyone so they can see the results of the audience. It looks like everybody is checking their blood pressure daily. That's fantastic. I'm glad to hear that.
I think it's the other way around, Michelle. It's 100%. Nobody is checking it.
Oh, nobody. I'm sorry. Oh, nobody's checking it daily. Oh, okay. That's fine too. Thanks for intervening. Okay, so nobody's checking their blood pressure daily, and that is actually okay too, which is my next slide. I'm going to end up addressing in just a second. We have how often should you be checking your blood pressure, and when should you check it? So I have a very variable answer. It depends on several factors. So if you are on a blood pressure medication and you have been taking it consistently, you may be able to just take it like once or twice a week, and that would be okay. Just to get a baseline at home if you have a home blood pressure device to check it on. Others that don't have any blood pressure issues, it could be that maybe you just have your annual checkup and you find out, oh, my blood pressure is actually normal because you don't have a machine. That's okay. I would suggest those that are told that they have like a borderline blood pressure, hypertension, to actually take their blood pressure at home. And we'll go over the chart on what I'm referring to in just a second. But ultimately, your cardiologist would be involved if you are falling within a worrisome range. So usually my patients in our cardiac rehab program, if they've been prescribed blood pressure and we notice that their blood pressure is trending a little on their higher side, meaning like 130/80, I end up sending them home with the blood pressure log, and they are also on a new medication. So we want to have them check it within 1 hour after waking up. and about 1 hour after dinner or in the evening. Some of the medications are taken 2 times a day. Sometimes there is a combination of medications that they're taking. I highly recommend you guys to wait 1 hour after waking up, because typically blood pressure is a little bit elevated when you wake up, partly because it could be anywhere of a variance of 10 to 30% of a variance for the increase in blood pressure. It's always the highest when you wake up. So if you take it right when you wake up, it's not accurate. So that's what I've been recommending, and obviously I would recommend you to follow up with your cardiologist if you're concerned with elevated blood pressure. And let's go on to our next screen. So instances that elevate your blood pressure. So I mentioned waiting when you wake up, when you are having stress. Jason did an excellent job describing how to go about decreasing stress. Now, there aren't exactly a lot of studies that talk about increased exposure to stress and how it relates to blood pressure, but your blood pressure definitely increases when you are in a stressed state, and that momentarily goes up and then comes right back down. Smoking, cold temperatures, exercise, caffeine, certain medications, all of these are instances that increase your blood pressure. With exercise, it's kind of similar to a stress state, meaning that it's actually normal for your blood pressure to go up when you exercise. We anticipate it to go up when you exercise, and then we also anticipate it for it to go down after exercise at rest. Cold temperatures, that's also another stress state. Smoking is pretty harmful for your vessels, and it increases the damage in your vessels. And so you are basically increasing a blood pressure just by smoking. So if you can quit that smoking, that would be fantastic. And then I have here caffeine. Caffeine increases your heart rate a little bit and your blood pressure, but not by much. I don't have very many studies that talk about it, and for those that are interested, I may be able to dig up a couple studies on caffeine. But if you guys have been drinking caffeine, I would say probably you can continue as long as you're not going overboard with it. And certain medications that elevate blood pressure, I wanted to go over. So some of the medications over the counter, like NSAIDs, which are like ibuprofen, they can cause your blood pressure to go up, but only slightly. And that is only because it interferes with your kidney, and that can cause a little bit of an instance where the blood pressure is going up. And then we have decongestants, and we have people that are taking hormones like estrogens and androgens and birth control pills that can cause an increase in your blood pressure. We have antidepressants and several different kinds that could potentially increase your blood pressure. And certain kinds of steroids that you might be placed on could also increase your blood pressure. So these are some of the instances that I've discovered that can elevate your blood pressure. We have new guidelines from 2017 from the American College of Cardiology and the American Heart Association as to what's considered a healthy blood pressure range, and what's considered a little bit worrisome, and what's considered elevated. So let's go into it. So the normal range is anywhere between 120 and 120 over 80. We have an elevated range anywhere between 120 to 129, but less than 80. The hypertension stage is stage 1. And that is 130 to 139 over 80. And that is basically the time frame of when I end up giving a blood pressure log to our patients for them to record how high and low it is, and if maybe there needs to be a conversation with the cardiologist on whether they need to be added on with another medication. But I'm no judge of that at all. I think most cardiologists, when they have a patient that has elevated blood pressure, they are encouraging lifestyle changes, meaning changing in diet, trying to lose the weight, and adding some exercise. And going on to this orange state, the high blood pressure stage 2, you have 140 or higher with the diastolic of 90 or higher. So if you're having these readings at home, I definitely want you to consider sending a message to your primary, or if you don't have a cardiologist, and potentially maybe just circling in with them since you're already now in the stage 2. I have a hypertensive crisis where it says consult your doctor immediately. But I would say that you would want to be consulting your doctor if your blood pressure is 140/90, certainly. Hypertensive crisis is mainly in concern for stroke. So if you're having a blood pressure 180/90 or 100, then your blood pressure, I would say, is uncontrolled and you're putting yourself at a risk for a stroke. So that would be a kind of an ER call, or maybe potentially call your cardiologist, but you could start to worry about having any types of symptoms of stroke. You have left side or right side weakness, drooping, slurred speech. Any of those are immediately a 911 phone call. Okay, so these are the new categories that we have that everyone is following. We have now on what are some of the causes for blood pressure. So believe it or not, it's actually unknown. We have genetics possibly to blame for. We have obesity to blame for, diabetes, stress. Could be a combination of the minerals that you have in your body. You may not have enough magnesium, calcium, or potassium. There's lack of activity, chronic alcohol consumption. That could be all explanations for hypertension, but there's actually no pinpoint cause as to why you end up having it. 5 to 10% is contributed to secondary hypertension, and that could be due to having kidney abnormalities, maybe kidney failure. The certain medications is what I had mentioned earlier about the decongestants and the NSAIDs, which are the non-steroidal anti-inflammatory drugs that you can get over the counter, and the decongestants and some of the hormonal medications that you may end up taking. So that could be a potential cause to having blood pressure. And then some congenital heart defects, which are on the rarer side, but you would end up knowing at birth and then having some kind of a surgery to help correct it. Those that have congenital heart defects are followed by their cardiologists and specialists for their lifetime. So that's the two different kind of categories for essential and secondary hypertension. So what are the risk factors for hypertension that are uncontrollable? I mentioned it in the previous slide. You can't really control your age. You can't really control your race or your gender or family history. And you have controllable risk factors, which we had Jason talk about diet, and diet is huge in terms of controlling your blood pressure. Cigarette smoking, excess weight, lack of exercise, high cholesterol, excess alcohol, drug abuse, high sodium. Drug abuse is also related to people that are having, unfortunately, methamphetamine abuse. That can also increase the blood pressure. Alcohol, you're definitely adding a little too much weight, actually, and that contributes to having a higher blood pressure. Excess weight is a big one. By just being able to reduce anywhere from 10 to 20 pounds, you could potentially lose 5 to 20 points on your blood pressure for the systolic number. I have low potassium intake, high sodium intake, low magnesium intake. So everyone's body structure is a little different. And I have also here sleep apnea. A lot of patients, surprisingly, end up snoring at night, and that actually leads to lack of oxygen. And I recommend those that have partners that notice that they stop breathing for a period of time to end up getting checked out and doing a sleep study. That can be requested by your physician. And you may end up having to need increased oxygen while you're sleeping, so you might be on a CPAP or a BiPAP machine. Okay, so some of the 5 pieces of advice that Jason and I are, going on about are losing weight. So for every 20 pounds you lose, you can lose anywhere from 5 to 20 points off your systolic blood pressure. Diet is a huge one. Eating a low-fat, diet-rich diet with fruits and vegetables, anywhere from 8 to 14 points. That's pretty significant. Exercising daily. anywhere from 30 minutes a day, walking briskly. And you can also end up cutting up the exercise to like 10-minute increments. And that goes to 4 to 9 points, limiting your sodium intake. So eat more than 2,400, 1,500 actually is better. I have recommendations to be somewhere like around 2 grams. But the less salt is the best, because the reason why we end up saying less salt is because it increases fluid retention, and the amount of fluid that you have and you're holding onto your body increases the amount of the amount of pressure the amount of fluid that is going through the entire body that your blood and heart that your heart has to pump. So that's one of the big reasons. Limiting alcohol, we have recommendation for 2 drinks a day for men and about one drink a day for women. And I have the 1 drink classified because, 5-ounce glass of wine is not the same as a full glass of wine, because a full glass of wine can actually be 2 servings. So going on to weight loss. So I mentioned that weight loss is actually a significant part in reducing calories, reducing your blood pressure on your systolic top number. But so it really is important. It's a quality kind of foods that you're putting in. You can have a very healthy sandwich that has the amount of calories, or you could have a piece of fat that is the sugars and fats, and that also is calories. So quality calories is very important as to what you're putting into your body. You can eat fewer calories than you burn. So that sandwich is 1,750 calories. It's just an example. You're taking in 1,750 calories. The goal is probably something close to 2,000. And if you eat about 2,250, you can negate it by going for a walk. And then that kind of tips the scale into an even 2,000. But ideally, if you wanted to lose 1 pound of fat, that's 3,500 calories. And that is 500 calories less than what you're eating every day. So I would say if you can try to reduce the amount of food that you're eating per meal, that would be great. The suggestions that Jason had brought up, I particularly liked the pasta images of vegetables mixed in with your pasta. Very key, trying to get high quality fruits and vegetables versus the refined carbs. And now we'll go on to exercise. So why should we exercise? First off, it makes us feel great. It tones the body. It gives us the ability to pump the heart in a healthy manner and allow us to distribute the blood throughout the body. It gives us the opportunity to also lose the weight that we're talking about. It reduces stress. So there are a lot of great factors to exercising. So before you decide to do an exercise program, I think it would be advised for you to talk to your physician and ask if you have any limitations. Some limitations possibly could be that you have hello? And you have so that would be something for you to address. There is a decreased workload on the heart. So after exercising like anywhere from 1 to 3 months, your heart gets a lot stronger and therefore more efficient. And then you are not stressing the heart as much as you were before when you were not exercising at all. More efficient oxygen delivery and retrieval process, decrease in resting and exercise blood pressures. So I was mentioning somewhere between 1 to 3 months. Everyone's different. You can get a great benefit after just starting an exercise program. And within 1 month, you may notice that you have a decrease in your resting blood pressure. And that's fantastic. You have increased endurance in your strength and stamina, improved cholesterol levels. Exercise actually promotes the levels of HDL, which is the good cholesterol when you're exercising. And overall, with time, exercise actually reduces the total cholesterol. So you'll have reduced triglycerides and LDL. There's a decrease in sugar levels in the blood, improved body composition, and then I mentioned overall well-being. So I'm going to quickly see if I can do another poll, and I would like to ask you, just a second. Let me do that again. Okay, so does everybody see this question? Are you exercising at least 30 minutes a day, 5 times a week? I'm just kind of curious. I personally am exercising somewhere between 30 to 45 minutes every day, in one fashion of another. Some of my exercise is not entirely cardio related. I do yoga. I also like to do a lot of walking, and I consider walking to be one of the best exercises for your body and stature. Okay, so let's see, how's the audience polled? I'm going to share the results. Okay, so we have about 2/3 of our audience members doing no exercise. Okay, that's okay. I mean, we're all going to be learning something today and start off hopefully exercising. So that's fine. And then those that are, that's fantastic. Keep on going. Okay. So how can we get more exercise? So right now we're in this quarantine state. I included a couple images of things that we can do right now. I know that we have the orders to basically shelter in place, but you're allowed to go outside and have a walk as long as you're wearing a mask and you're distancing yourself. I have this kind of a little pedal machine that my mom purchased, and she's having that sit in front of the couch while she's watching TV, and that's giving her a little bit of muscle tone, and not as much cardio as a walk, but it's giving her some muscle tone. She says that she feels it. There's also the option for those that have indoor bikes. I know that right now the gyms are closed, so there's no opportunity for us to go and use the machines available to us, but possibly if you have an indoor bike, that would be great. I also put down a little bit of resistance training, doing bands. There are numerous workouts that you can find on YouTube that you can look into, seeing how they would incorporate band work into doing exercises along with weights. Those that do not have weights can also use things like household items, canned goods that are approximately a pound for weight resistance. Normally that's recommended anywhere from 2 to 3 times a week to do the strength training. It's very good for our bones and for our stature. So I mentioned that you don't necessarily have to do 30 minutes up to in one session, one go. It may be actually kind of difficult if you're starting off to exercise to just start off with 10 minutes and do a gradual increase up to anywhere from 30 to 60 minutes a day. It's nice to keep track. I actually have a log personally just to see how I'm improving in terms of what I'm doing for my sessions and my time. Yeah, it's just a nice log. And then things that you can do at home, you can be dancing at home. When we are finally back out of shelter in place, we can potentially do walking as transportation. Actually, we can do that right now. We don't necessarily have to do that. I had earlier edited this slide because it said talking about taking a bus. I don't know where we are yet with the bus transportation, but taking a bus and then stopping a little bit earlier and then nicely going for a couple block walk to your final destination. So what else do we have in terms of exercise? You can also find really great aerobic videos that you can do at home that are on YouTube. And some of the things that you can end up doing, that the weight control registry to keep the weight off, is living a lower calorie lifestyle, eating consistently from day to day, eating breakfast daily, going for a walk. You know, I would say start off small. 60 minutes is like a goal. It's like a target. But the actual recommendations is 150 minutes a week, 30 minutes of moderate activity. Moderate activity is going for a walk 5 times a week. That was one of the reasons why I was curious to see what the poll answers were. And then watching a limited amount of TV. I know it's really hard right now. We're cooped up and it's hard to not watch TV, but just even walking around your home from like the kitchen over to the living room a couple times might actually be great for you. Weighing yourselves frequently, at least once a week. I'm a little controversial with this. I like to personally see how weight feels in your clothing, but this is especially important for those that do have heart failure, because they are wanting to make sure that you are not gaining any extra weight, and that they are weighing themselves daily. So you want to take your action with your weight before it increases. So I would say you could just start off really small, just changing the diet habits, incorporating a little bit of exercise, and then you would notice start to notice a decrease in your blood pressure. So being physically active helps lower your blood pressure. You want to make sure that you inform your doctor and ask about limitations. 5 times a week, doing 30 minutes of activity. It basically helps to achieve a healthy weight, and about 60 minutes a day to lose weight. We talked about calories in and calories out in the beginning. Using a stair instead of an elevator, get off a bus stop 2 stops early, park your car at the end of the lot and walk. I also actually use this as a guiding principle. I park far, far away. I've always have, and right now it's particularly helpful when I go grocery shopping, just far away from everyone, and go for even a longer walk than I usually do with my groceries. And I mentioned in the very beginning that smoking is really detrimental. It's one of the #1 risk factors for cardiovascular disease. It injures your blood vessel walls, speeds up the hardening of your arteries. And there are a lot of medical treatments. They have something called the smoking cessation patch. I'm thinking of another one. I think it's called Chantix, that could be prescribed. Some people like it, some people don't. I'm also wondering if maybe there might be some kind of a support group that you might be able to find online for those that are trying to quit smoking. This might be a great time to see if there are anything online right now for such things. And Jason did such a great job with stress. But I mentioned earlier that it's very difficult to find out what is the prolonged stress. There is an increased spike in blood pressure during stressful situations, but then it immediately goes back down. We don't have enough research that says the prolonged stress, but I mentioned earlier that I'll see if I can find anything. I'm particularly wondering if there's any studies going on right now for blood pressure and stress during this shelter-in-place situation. Stress also leads people to cope with unhealthy behaviors such as smoking, eating more food, unhealthy food like high fat and sugar, and reaching for alcohol for coping. So these are some of the reasons why we have an increase in blood pressure. All of these factors are contributing to high blood pressure. I think this just about concludes my presentation. I do work at the cardiac rehab. Currently, I am working inside the hospital. We're doing a lot of interesting jobs. Right now, we're waiting for our cardiac rehab facility to open up so that we can have our patients come back. If you have any questions, you can potentially leave a message, and when we are back in the office, we can get to you. We have also created a couple cardiac rehab exercise videos, and that is located on this web page. It's very hard to find when you Google it, so that's why I've included a web page, a specific address. And I guess now Jason and I will see if we can answer as many questions as we can.
Okay, now starting with the first question, is there a difference between regular salt and sea salt?
So I think I'll start with that one, Michelle, if that's okay. If you want to jump in, you can too. But yeah, so this is a really good question. And there, of course, are differences between salt, what we call salt, regular salt, and sea salt. Just know that, sea salt is essentially evaporated seawater. So it does require slightly less processing than conventional salt. And because of that, it does have has trace minerals in it. So there's a little bit of potassium, there's a little bit of iron sometimes, but they're in very small amounts that don't really have a big impact on health. And both sea salt and what we call regular salt or table salt have similar amounts of sodium in them. So it's not going to be an effective way to decrease your sodium intake if you use the same amounts of sea salt or table salt. One advantage to some types of salts are that they have a stronger flavor. So you may end up being able to use a little bit less of it. And this generally works when you're putting salt on your food after you've cooked it. Excuse me. So I'm thinking here things like flaked salts. The shape of the salt itself actually is easier for the taste buds to access. So you end up getting more flavor with using less. Thank you for that question. Yeah.
The next question is more about how to intuitively consume the recommended amount of salt. The question is, I'm not good at remembering measurements. So what is the recommended daily salt intake in terms of coin size, for example?
Yeah. So this is something I work with patients on too. So I'm gonna be hogging maybe these first couple. They probably came up during my talk anyway. But yes, so portion sizes, not just for sodium, are challenging for people, but also for meat or vegetables. And I often like, and many dietitians use hands. So you can understand the size of something just comparing it to your hand. Something like a piece of, a serving of meat for 3-4 ounces is about the size of your palm, about the same thickness. So in terms of salt, we've been talking about tablespoons, and a tablespoon is about the size of the end of your thumb. So that can help you kind of visualize that. It also is the amount that should fit into the palm of your hand, slight mound to it. So then in terms of coins, you can think of, I think, let's see, a little bit more than a quarter, size of a quarter would be a tablespoon. And then you can go down from there. A nickel is about half a tablespoon, a dime is about a quarter. So you can see, if that's helpful, thinking of visual imagery, when you're looking at something.
Thanks, that's really helpful. The next question I think might be more for Michelle, and I think you might have already answered this or touched on it a little bit. But stress versus smoking versus alcohol, which would be the most dangerous for blood pressure? I think you just unmuted yourself.
Got it. Okay, got it. Sorry, I thought I was talking, then I unmuted it. So yes, this is such a great question. If I had to do a hierarchy, I think you probably should quit smoking first. Second, reduce the alcohol intake. And third, reduce the stress. The smoking has such a damage to your blood vessels that you can get an immediate response for improving its elasticity and blood flow and reducing the hardening of the arteries just by quitting smoking. Alcohol, it's kind of iffy, but overall, I would say that it's a good idea to reduce your alcohol consumption. So I mentioned 2 drinks per day for men and 1 drink per day for females. And that's just one of the guidelines that I send all of our patients with, just in general. And then stress, I mentioned that I think it's a great idea to reduce your stress. Right now, especially with the deep breathing exercise that Jason went over, the box breathing. I think that's essential if you're coming into a situation where you're feeling an extraordinary amount of stress to practice the box breathing.
Great, thank you. The next question, blood pressure monitors. Which do you recommend for home use?
Oh, that's such a great question too. So in our cardiac rehab, we have a machine called Omron. It's spelled Omron. Internationally, this is one of the best machines to use, and it is a great home blood pressure monitor. I've recommended it to every patient. There are different models, and you can get the cheaper model on Amazon. Could be like $20 to $30, and they have these really fancy ones that are $80 that are Bluetooth, where you can send the data to your phone and then allow yourself to pull up the data and show it to your cardiologist. It doesn't matter what model you get. I strongly feel that Omron is one of the best, and our physicians feel the same way. Great question.
Thank you for that recommendation. Next, is stretching helpful for blood pressure?
So that's it's like a two-part. Okay, so first part with stretching, I think that it helps with lowering your stress. And also it helps you with your flexibility in your body. It's more basically for muscle tone. It may decrease the amount of blood pressure that you have, but it's mainly for you feeling good in your body. To get a true benefit with lowering your blood pressure, you would need to do some cardiovascular exercise, meaning going out for a walk. You want to be able to raise your blood pressure. With stretching, you're not really raising your blood pressure.
The only thing I would add to that, that's a great.
Oh, sorry. Go ahead, Mike.
Yeah,
go ahead, Jason.
That's a great point, Michelle. And also, thinking of stress, it can be. Michelle mentioned, practicing yoga. Which can be more than just stretching, of course, but you can use gentle stretching as a stress management technique too. So, if you're thinking of being able to decrease the impact of stress on your blood pressure, perhaps a daily stretching practice can be one way to do that.
I agree.
Awesome. And the next question actually relates to that last question. Sorry, I'm just misreading. This one doesn't relate to the last question, but the next question is, what are side effects of blood pressure medication? And to use exercise to lower blood pressure, does it matter if it's aerobic or not? So yes, still related to what we were talking about.
Okay, sure. Can you repeat that last part? You cut off a little bit, or I didn't hear you correctly.
Yeah. So this is actually two questions. Possible side effects of blood pressure medication, and if you're exercising to lower blood pressure, does it matter if it's aerobic or not?
Does it matter if it's aerobic or not? Okay, so I'll first tackle the first question. So there are certain side effects to having certain blood pressure medications. It actually varies. Okay, so I know that lisinopril is typically giving you a cough, although some patients don't have it at all. So that's just one of the ones that are most common. It's quite possible that you might be on a blood pressure medication. You end up changing all your lifestyle. You're changing your lifestyle risk factors, meaning you lost some weight. You finally are exercising, you're eating healthy, less sodium, you stop smoking, and maybe the blood pressure no longer needs to be on board. So then you might be needing to have it taken off by your cardiologist. So then you might feel lightheaded. You might feel volume depleted, meaning that you might have signs of dehydration with an increased heart rate. Those are the ones that are coming off the top of my head right now, but every drug that there are a lot of drugs out there that have side effects, and normally when you get prescribed a blood pressure medication, your cardiologist would want to follow you for some time to see how you're doing on that medication. I know that another really common side effect when you're starting something called a beta blocker, a drug called metoprolol, one of the drugs that end with the LOL, could be fatigue, crushing fatigue. You might not feel better until a couple months later. So these are the ones that I'm just seeing off the top of my head right now. But ultimately, you would be in communication with your cardiologist when you're on these medications to let them know if you're feeling any symptoms or adverse effects. And then the second part, doesn't matter if you're doing aerobic or anaerobic exercise. So aerobic exercise is what is keeping your heart rate up and allowing your heart to get a little bit stronger. The anaerobic exercise are the stretching and more of not keeping your heart rate up, but yoga, depending on what kind of style you have, can raise your heart rate up depending on the style of yoga you're practicing. It doesn't actually, for aerobic activity, cardiovascular health, it does matter that you are doing aerobic exercise. So I mentioned going back to 5 times a week, doing 30 minutes to help your heart. I hope I answered that question. Okay.
Nearing the end, this is the second to last question. Do you recommend taking a fish oil supplement regularly?
Is this for me?
Heart health.
Is this for me or for Jason? It's for me? Okay. That's a very good question.
I think it could be for both.
So I think that's going to be something you're going to end up deferring to your physician. Only because I don't know what the cholesterol panel looks like for the patient. And I don't know what other problems the patient may end up having. So I have a hard time just saying yes or no. So this is going to be a question that you're going to end up asking your physician.
And I would say also, there are things like, studies around specific nutrients. So this is an example of that. Fish oil being DHA and EPA. These are essential fatty acids. We can get them from food. We can also, concentrate them and put them into a supplement. And studies about doses, like mega doses, we call them, of supplements are mixed. Sometimes there is a benefit, and in fish oil, there are some studies that show an improvement in blood pressure with fish oil. But again, the research on most of these things is mixed. So it is good to talk to your physician about it, because it's a complicated question that involves, seems to have an individual response to it. But you can also look at what is the basis of what's in the supplement. So looking to the foods that supply those essential fatty acids could be a way to ensure that you're getting the benefits of that without maybe overdoing it and causing, and maybe, being something that could be harmful in some situations. You wouldn't obviously need to talk to your physician about eating more fatty fish in your diet.
Mm-hmm.
Thank you for that. The last question is, isn't a more elevated blood pressure as we age a normal thing? Therefore, it's not something to worry about, for example?
Well, I guess the question I would ask is how high is the blood pressure? Can you repeat the question one more time?
Sure thing. Isn't a more elevated blood pressure as we age a normal thing, i.e. not to worry about?
I think if you're having a higher blood pressure in the categories, I'm actually going to go back to that slide. I'll give you 1 second. Go back to that slide where we are talking about the pre-hypertension state that's been removed. So we now only are focusing on stage 1 and stage 2. Those blood pressure readings, I'm sorry, this is kind of strange that I'm eliminating these slides. This is the slide that I want to refer to. I would say that if you are in this high blood pressure range, stage 1 or in stage 2, I would definitely talk to your physician about how to go about mitigating this high blood pressure. Most likely, they will end up telling you that you need to do some lifestyle changes. The question about if it's normal, well, I mentioned in the very beginning that high blood pressure is essentially unknown. There's about 90% of it that's unknown for essential hypertension. It could be that you have elevated blood pressure due to the amount of weight that you're gaining. I know that weight gain happens as you increase because the metabolism slows down. So yes, the blood pressure would go up if you are not exercising and you're eating poorly. But I would go back to this chart again to refer to it. If you are following in this orange to like a medium orange range, that would be a signifier that you are in stage 1 or 2 and that something needs to change in your lifestyle so that you are now in a normal, like more closer to a normal blood pressure. I hope I answered that question okay.
Yeah, thank you so much. We are past 5 now. Thank you for all of the great questions. I really enjoyed the discussion.